Welcome to another edition of Healthy Exchange. I'm John Reynolds, President and Chief Executive Officer of CieloStar, and I'm joined today by Pierce McNally, our Chief Strategy Officer, and we're talking about the rise of consumerism in the health and benefit marketplace. There's just no doubt, given all the changes that have been occurring over the past decade, really, with rising healthcare inflation and a number of other related elements in the healthcare field, that we're going to see this trend continue to expand.
More and more consumers say more and more of the time that they want to have more and more say over their benefits. They want choices, they want accessibility, they want the ability to make the same kinds of choices that we see that consumers are now making in the retirement marketplace with 401k plans.
Well, and why not?
Good question, why not? Because the consumer is becoming more and more prevalent throughout all aspects of society, whether that's in retail or whether that's in government programs. And so the idea of the consumer having this kind of choice in the health and benefit arena is something that is simply going to pick up speed. We've seen it come from a very small beginning back 10, 12 years ago, and now we have this enormous train that's going down the track that has this alphabet soup of health reimbursement arrangements, health savings plans, health flexible spending arrangements, et cetera, et cetera. And so I think, John, we're going to see more and more of it, and we'd better get used to it because it's in our future.
Well, and I think that there's no doubt that over the course of the past decade that people have finally come to the realization that somebody else isn't going to take care of this problem over the long haul. And
one of the things we talk about in our book, Overdose, Your Health, My Money, is that one of the issues constantly crops up that somebody else will take care of the issue. Either the doctor will make me well or somebody else pays for it. Everything is now coming down more and more to personal accountability and that personal choice. And so the rise of healthcare consumerism in that context is no surprise, because one of the few ways that we're going to be able to get our hands around the costs associated with healthcare in this country, which is a large problem.
You know, Pierce, when you were talking a second ago, I was thinking to myself, I could really use a new coat of paint on my car. But I can't go to Travelers and have them pay for that.
They're not going to pay for it.
Why do we expect that?
That's exactly the point, is that that's not insurance. That's maintenance. And one of the things that we can do as a society is to make sure that we have personal accountability for our own maintenance, and we're not going to be able to turn to somebody else for an oil change or a paint job.
So now we talk a lot in the industry about how the young pay for the old, the healthy pay for the sick, and to some extent the wealthy pay for the less fortunate.
Correct. And there is, in fact, no other way that you can construct a healthcare system. It's not fair, it's inequitable, and so the public policy response needs to be how to soften the edges of that. And that's where healthcare consumerism comes into the equation, and I think that's one of the reasons why we're seeing the rise of healthcare consumerism as we move forward.
Well, and I'd like to think that's why we built CieloChoice.
CieloChoice, the health benefits and the health benefits exchange that is set up as a private exchange that will allow people the accessibility that we're talking about. It will allow transparency, and it will allow choice. So next week, let's talk about the CieloChoice Health Benefits Exchange and its benefits for all of us as we go forward.